mixed up. But I was able to get my vaccination. All my friends, my coworkers, and people that I know needed the vaccination, UMMC made it possible for us to get it. I got my first and second doses from UMMC. I've also received my booster. The nursing industry has a critical shortage. So all of you are doing a great, super job. I'm a healthcare provider and I know the pains and the angst. I receive excellent care here and I'm alive today. Otherwise, I would be statistics by now. But I'm alive because of the super care that I got. I did not know anything that was going on until 14 days later. Then I went home and I was quarantined for 3 weeks. So I thank each and every one of you. Dr. Baran is not here. Saeed, I thank every single person. And please continue to do the job. There's so much disparity in our healthcare industry, and we need UMMC. Every single person. Woo! I'm black. Woo! I need UMMC. Every single person. So thank you very much.
Dr. Verone's, Dr. Joseph Verone's father is ailing. He will be here for the meeting that we'll have with CMS, but he is certainly well known for never leaving this hospital and continue to fight. So we thank you for acknowledging him. Dr. Moyen never left as well. She is the CEO and has been with this hospital for more years than we can count. And so we're delighted to have her here. She will be at the forefront of answering the concerns and reporting on all of the corrections that have already been made. Dr. Moyen.
Can't hear you, doctor.
Sheila Jackson Lee is our mother, because she is our mother for this hospital. I also thank for supporting the hospital. And to staff, I'm so proud of my staff. Thank you so much for your support and being part of our team. We have been there ever since the COVID came in. We were the first hospital that opened testing here. The first hospital that opened beds here. Converted overnight. We did not have extra beds. We converted that into COVID. We trained our staff. Nobody in Houston or any of the United States or in the world was trained to take care of COVID patients. We did on-the-job training for our staff to take care of these patients. We saved a lot of lives. We opened outpatient clinic. We started with 10 beds, COVID beds. We immediately turned them into 20 to 40, and then we converted one of our major units into COVID as well. So, you have to understand, UMMC has been struggling a lot, working very hard day and night. We have 12 ER beds. All of the 12 ER beds at one time were occupied by COVID patients, and we had no beds left to admit the patients. We diligently, my ER staff, my COVID staff, and my medical and ICU staff worked very, very hard. I'm very emotional.
You can do it, doctor. You're doing a good job.
We have have worked endless days and nights, and we are still working with all the problems we have. We are resolving them and moving forward. We will never give up. We are staff, I'm very, very grateful to you for being there when we asked you to be there. People have worked relentlessly, and they have worked hours and hours without thinking whether they will get paid or not get paid. The staff was so committed, and I am so grateful. We will continue. We will be in this struggle together, and we are going to win. We have accepted patients from not only from Harris County, not only from this area, but far as Lubbock, as far as El Paso, New Mexico. We have life-flighted patients, and those patients were discharged alive. This is what we get for this. Everyone must understand we are in this COVID pandemic war together. Nobody can say UMMC did not perform. UMMC will continue, has performed, and will continue to perform. And I thank you very much, Congresswoman, for being there for us.
We will open it up to questions. I think there's one thing that I want to emphasize very quickly. I thank Steve Williams and the mayor and the city council and the city health department. With a little bit of old history, Sheila Jackson Lee saved the city health department. I have to laugh because it was a plan way back when I was on city council, a long time ago, to merge the city of Houston Health Department. He probably could find that plan in the archives with the Harris County Health Department. I love them both. But I'm glad to say that there's a purpose for the city health department, is it not? Somebody needs to say yes. Is it not? And a purpose for the Harris County Health Department. Nobody ever knew that we were going to run into a pandemic in 2020 where we needed these boots on the ground to work with your boots on the ground. And no one ever knows how we're going to face this next surge, and we need UMMC's boots on the ground. Before we answer to questions or accept questions, let me also again thank the National Association, NACA. Let me also thank NACA. There's been a steady stream of cars. They've got vaccinated, their first or second shot, they've got their boosters, they got their children vaccinated, and they've got tested. We're doing all of this at one site and giving out goodies right behind, not because we want to say, you got to get the goodies, you got to get tested, but because we're saying thank you. We're glad you're here today. Thank you. Dr. Mabry is a walking testimony in and of itself. He's an outstanding ear, nose, and throat doctor. He is the longest-serving physician here, and he has his own story to tell. Dr. Mabry.
Have shut down. There used to be 5 hospitals in this 2-mile radius, and now UMMC is the only hospital between here and about, I think, 8 miles is the closest.
That's right.
This hospital, it does interventional cardiology, where they literally stimulate people to where they stop breathing and then bring them back. And they do. I've done things here with my family, with my friends, and they were my classmates all because they listen to the hospital. It's a COVID shot. them over here. Separately, I've had friends and family who've had prostate cancer. We deal with head and neck cancer here. And we've saved quite a few people on diagnosis because all of the equipment and all of the information that's necessary is here at this hospital. The doctors who do these things are at this hospital. So I think that the biggest thing that I would want to share is that UMMC is here for the community entirely. We have our medical issue. We don't have to leave the community. The problem is certainly healthcare is changing, and UMMC is fighting a lot of different fights as far as insurance companies, healthcare, and being able to stay within their community. But if they come here, and when they come here, then here the doctors are here, the knowledge is here, and the ability is here. So again, I want to say that Congresswoman is one of the reasons that we have been able to stay and do what we do. Thank you so much.
So when we started out, I've been so impressed because we have a steady stream of cars. Our messages run out in the community. Omicron is here. Get yourself vaccinated. Get yourself tested. Get your children vaccinated. And all of that can be done right here at UMCC and its various centers. But I'm very proud to say that we're at Legacy Apartments on Lockwood. We went right to them. And we're doing children and adults, and we're happy about it. So here's where we are. We are very glad to say that after meeting with CMS this past week, they have an official meeting with the Chief Medical Officer, Dr. Perron, and the Chairman of the Board, and I just want to acknowledge him, John Okereke, almost. And the Chairman of the Board is a specialist in cardiovascular surgery. So that's why we can be a small hospital. It can be a small hospital, UMCC, and still do the kind of unique services that are so very important. So I want to thank the physicians that are here, who have been faithful, and I know that the people who have spoken will be willing at this time to take some questions.
I'm sorry, is UMMC in danger of closing? Is that what you guys are saying, or are you trying to amp people up to come get tested here? Just trying to clarify the message.
The message is that we, at UMCC, has 4 sites. UMCC is continuing to do the COVID vaccination testing, working with many of our partners. It has received a letter from CMS that indicates that this facility has to respond to. And the first response was that the decision was the final one. We're glad to say that this hospital will be meeting with the federal agency, CMS, to be able to present all of the solutions that they've already done and to work through so that this letter that was received can be modified. That's what they're looking to have done. The letter referred to the losing of the Medicare and Medicaid status, which is very important, but they have all of the information of corrections to ensure that CMS, that is their partner, that's their partner. We want to make sure that we are at level excellence. These people were speaking to say that there is level excellence work going here, that lives were saved that could not be saved anywhere else, that this hospital is in a location where 8-10 miles away, and that if somebody gets to this door from around this area, they can't get to any other door. If they had to go to some other door, they just might not have made it. That's how desperate people have been walking through these doors or being brought here by the ambulance, and they've had flight helicopters come in, airlift, life flight, get its name, from all over. They've been used by the first responders, EMS, here in this community, and so we can't afford to lose them offline. But what was last week is a different thing this week. This week, they will be sitting down in meetings with the federal leadership and be able to cite everything that has been done and that which they will do. But again, they represent 4 systems, 4 hospitals around this community, and many of them are put in places where there are no other health facilities. And And we've come here today to say we want the community to stand with us. And when I say we, because I represent this area in the United States Congress, and we want the questions of anyone to be answered. That we are top notch, meaning this facility has continued to have this level of staffing and positions, and they've never stopped. And the same tributes that we gave to nurses across America are due to the nursing staff that is here, because they have not stopped. For I see shaking heads from that moment when COVID came, and a lot of people didn't know what it was, didn't understand what it was. A lot of hospitals didn't understand what it was. And here we are. I just want to give one note. I started interacting with COVID-19 when I went to the airport and asked them, what are you doing about international travelers in February of 2020? But more importantly, I got introduced to the New York Presbyterian leadership and started getting my information directly from them. And they indicated that they just didn't know what to do with the teeming number of people that were showing up at the emergency room. And they just put them in hospitals, and that's why you heard these big pronouncements, where the ventilators. That's the only thing they knew what to do. And in that instance, they had people, they weren't operating, they weren't doing anything. So people were in ICU, they were in the operating rooms, they were in the hallways, and that was firsthand from the doctor who was kind enough to interact to help me understand what was coming through his system. They didn't know what to do. This hospital, as you heard, developed protocols to be able to be as helpful as possible to those patients of what I have been told and what I've seen. So the idea here is for us to support the ethics, and what we had last week was a letter. What we have this week is the ability to sit down with the Chief Medical Officer, Dr. Joseph Rose, the Chairman of the Board, and all of the staff that know what's going on here to work through any concerns that might be at this time.
That being said, too, what are the city and hospitals doing to prepare? I know we're anticipating a surge. It typically happens in the winter months. What are y'all doing to try to prepare as if we do have that surge, we'll have two active variants for the first time in the pandemic. And I know that last surge we had people being treated in the hallways. What are you doing to try to avoid that this coming surge?
I just want to also acknowledge former Councilmember Ben Reyes is here. I don't know if he's still here, but I just want to say that Councilmember Reyes was on council at the time that we kept open the City of Houston Health Department. So just want to acknowledge him. But Steve Williams will come, and then I'd like one of the doctors from this hospital to talk about what you're expecting to serve. And thank you, Steve.
Well, I can't really speak to the hospital because really our main focus on the Houston Health Department standpoint is certainly testing and vaccination. And I think really the thing to stress right now, given the fact that there might be a surge, is that we need to continue to encourage people that are unvaccinated to get vaccinated. We also need to encourage people who haven't taken their booster shot to take their booster shot. We also want to continue to wear masks in indoor settings and when you're in settings where large. One thing that we know now is that we have a lot of vaccines also served on the same vaccine, the vaccine advisory committee. We haven't met with several groups. So one of the reasons for that is that the infrastructure in place to actually distribute these vaccines and vaccinations is hard to obtain.
I think it's a very important question. Thank you so very much. You've heard the president's protocol that he wants to put in place. I believe that it's going to be crucial